Welcome to Study Channel by Nurse. Dear candidates, in this video we discuss ESIC Shift 1 Previous Question Paper Solution 2016 Part 5. This is your first time here. Subscribe and press the bell icon for new upcoming artists. Let's go to the class. Question number 61. Which of these is not the sign of pre-eclampsia? Option A, proteinuria. B, high blood pressure. C, edema. D, pyrexia. The correct answer is option D. Pyrexia is not the sign of pre-eclampsia. Next. How many positions are seen in breech presentation? Option A, 2 position. B, 4 position. C, 6. D, 8. The correct answer is option C. 6 positions are seen in breech presentation. Next. Big and body uterus with bleeding and rapid pulse rate in the third stage of labor are the sign of option A, retained placenta. B, postpartum hemorrhage. C, rupture of the uterus. D, adherent placenta. The correct answer is option C, rupture of the uterus. Next. Normal gestational period of a human being is option A, 9 months. B, 10 months. C, 280 days. D, 289 days. The correct answer is option C. Normal gestational period of a human being is 280 days. Next. When the occipital prominence escapes under the symphysis pubis and the head no longer descends between uterine contraction, it is called option A, restitution of the head. B, crowning of the head. C, external rotation of the head. D, extension of the head. The correct answer is option C, crowning of the head. Next. Vagotomy is a surgical treatment for option A, nerve disorder. B, peptic ulcer. C, hepatitis. D, regurgitation. The correct answer is option B. Vagotomy is a surgical treatment for peptic ulcer. Next. Immediate treatment of ingestion of poisonous substance is option A, forced diuresis. B, gastric lavage. C, seek info to identify the drug. D, induce vomiting. The correct answer is option B. Immediate treatment of ingestion of poisonous substance is gastric lavage. The term oma means option A, new growth. B, organ. C, opening. D, cyst. The correct answer is option A. The term oma means new growth. Next. The process of tightening of the fibrin clot in such a way that the rupture area of the blood vessels gets smaller and smaller, thus decreasing the hemorrhage, is called A, synorrhosis. B, fibrositis. B, fibrinolysis. C, synorrhosis. The correct answer is option D, synorrhosis. Next. First stage of the labor lasts for dash hours in primigravida. Option A, 2 hours. B, 8 hours. C, 11 hours. D, 6 hours. The correct answer is option C. First stage of the labor lasts for 8 hours in primigravida. Next. In dash disease, the symptoms in children is described as given by motor. Option A, ODD. B, OCD. Conduct disorders. ADHD. The correct answer is option D. In ADHD disease, the symptoms in children is described as given by motor. The ozone layer blocks dash from the sun. Option A, sunlight. B, infrared radiation. C, both UV and infrared radiation. D, UV radiation. The correct answer is option D. The ozone layer blocks UV radiation from the sun. Next, name the gas that cause global warming. Option A, nitrous oxide, B, carbon dioxide, C, sulfur dioxide, D, carbon monoxide. The correct answer is option D, carbon monoxide gas that cause global warming. Next, which is the important point in taking care of patient with communicable disease? Option A, immunization, B, hospitalization, C, isolation, D, care of utensil and articles. The correct answer is option isolation is the important point in taking care of patient with communicable disease. Next, rapid and irregular pulse rate and presence of heart murmur are the sign of option A, acute rheumatic fever, B, myocardial infarction, C, arthritis, D, angina pectoris. The correct answer is option rapid and irregular pulse rate and presence of heart murmur are the signs of acute rheumatic fever. Next, anaphylaxis is the term used in dash children. Option A, pyrexia of unknown cause, allergic reaction, C, prognosis of disease, D, excessive of sleep. The correct answer is option B. Anaphylaxis is the term used in allergic reaction condition. Next, permanent hardness of water can be removed by adding option A, bleaching powder, B, chlorine, C, potassium permanganate, D, washing soda. The correct answer is option D. Permanent hardness of water can be removed by adding washing soda. Next, dash is protrusion of an organ, tissue and structure through the walls of the cavity in which it is normally contained. Option A, cyst, B, hernia, C, fistula, D, lump. The correct answer is option B, hernia. Next, which of these is not a congenital heart disease? Option A, tetralogy of Fallot, B, tricuspid atresia, C, ischemic heart disease, D, arterial septal defect. The answer is C, ischemic heart disease is not a congenital heart disease. Next, this is a means of standardizing the method of evaluating and recording the condition of the baby in numerical terms at 1 minute after the birth and, if necessary, after 5 minutes. Option A, Apgar scoring, B, Silberman scoring, B, Bernstein scoring. The correct answer is Apgar scoring.